Well, we all know radiation to be a very bad thing. Somebody dropped a bomb in Hiroshima, Nagasaki. But radiation is medicine. Radiation is a dawai. Radiation is an anti-cancer treatment.
Max Healthcare Vaishali has recently added a new radiation therapy machine, the HyperArc Edge 3.0, in its radiation unit, taking a big step forward for the cancer treatment. To tell us more about this machine, today we have Dr. Gagan Saini, the Director of Radiation Oncology at this hospital. Hello and welcome, Doctor. First of all, congratulations for the new machine.
Thank you.
So, can you please tell us something about the Edge machine?
Okay, so Edge machine is the latest in the Varian family. It's a very high precision equipment. It works on the principle of linear accelerator, but it has inbuilt protocols that enable pinpoint radiation therapy for advanced stereotaxy and stereotactic body radiation therapy. Now, I must add one more thing that Max Vaishali, of which I head the department, has not only added the Edge 3.0 with HyperArc, we have also added ExactTrack Dynamic 2.0. Now, this ExactTrack Dynamic 2.0, along with the Edge system, gives me the capacity to focus on the target, which is being treated with pinpoint precision during the course of treatment. So, as the radiation therapy is going on, we can visualize the target for its precision. So, that is the benefit that we have now with the force of these two equipments together.
All right. And what is radiotherapy?
So, before we go and we start discussing about the deep points of edge and focus thing, why not discuss about a little bit about radiotherapy? So, what is radiotherapy really? I mean, what are we doing? Well, we all know radiation to be a very bad thing. Somebody dropped a bomb in Hiroshima, Nagasaki. But radiation is medicine. Radiation is a dawai. Radiation is an anti-cancer treatment. So, what radiation does is it's basically energy, and this energy gets deposited onto the DNA of the cancer cells. Now, the biology of radiation is such, which is calculated according to the dose and volume of the radiation, that it falls onto the cancer cells and it inactivates the DNA of the cancer cell, and that inactivated DNA makes the cancer cell unable to divide further, and sooner or later the tumor gets dissolved. It's not something to burn the tumor. When we feel sometimes that radiation is for burning the tumor, that's definitely not the way radiation therapy works. It's a biological treatment and it works by damaging the DNA. That's what it does.
Okay, sir. Also, why is it important to have radiotherapy on Edge, and which type of cancer patient is good for this therapy and who cannot use this therapy?
So, why radiation therapy should be done on Edge? The fundamental benefit of doing radiation therapy on Edge is the fact that you are being able to deliver the radiation therapy precise to the target, more than the point of the target, precisely to the decided target volume. The decided target volume. That's what is very important. Well, you switch on your torch in a dark room, you switch on the torch, it goes in one place, but you see the scatter everywhere else. That's how any electromagnetic wave behaves. The benefit of using the advanced technology is focusing it. That advanced technology has been focusing it for a long time now. But with this system, the protocols are more inbuilt. They are much more precise. They are much more focused. The precision can be as thin as this thickness of this nail. That's the precision. It's sub-millimeter, literally sub-millimeter. So that's the benefit of doing radiation therapy on Edge. You are getting your treatment, you are getting your benefit of treatment, but you are not getting side effects which are unintended. There are some intended side effects, but unintended side effects are not happening. So that's what is the benefit of the treating with Edge. Now, to come to the second part of your question, that which tumors should be taken on Edge may not be taken on Edge. So as I said, every tumor will benefit because ultimately precision is key, right? We can't say that some tumor should not be done with precision. I can't say that. So certainly each and every patient will benefit with Edge. But the patients who really, really, really benefit with Edge, for which Edge has been made and the protocols have been made, are the patients who need this pinpointed radiation I told you. So they are like brain tumor patients, small lung cancer patients, small recurrences, liver tumors, there are some thrombi or the tumor cells in the blood vessels, thrombus, we call it a thrombus. They are there. There are some abdominal tumors which require radiation, like pancreas. Prostate cancer can get radiation therapy pinpointed. Bone pieces, you know, behind the eye, so many places which can benefit because these are hard to reach areas, but now no problem. And the best part, as I would like to reiterate, is that it comes with ExactTrack Dynamic 2.0, which helps us making sure that when this precision is being done, during that time also, the thing is being monitored.
Okay. All right. So what is Exact Track Dynamics 2.0?
So what is ExactTrack Dynamic 2.0? ExactTrack Dynamic 2.0 is a adjunct to Edge machine. It's a machine that is installed in the same room as the linear accelerator Edge. And what it does is it makes sure that when the radiation therapy is being delivered by Edge. So first things first, the treatment is planned in a very precise way. The treatment is delivered in a very precise way by Edge. But when you are delivering that treatment, there can be movement of the organs. There can be, like for brain tumors, thin brain tumors, which are, as I sometimes say, that as thin as the nail. They can move even with the beat of the heart. Those movements are monitored by the ExactTrack 2.0 dynamic system, and that adds to the precision and, of course, the outcomes of Edge.
Does the course of radiotherapy depends upon the new machines?
It is sometimes thought that because something is high precision, the time of treatment can be reduced, or like the course can be shrunk or something like that. That's almost never the case, although it can be there in some cases. So, I can't give all the examples because so many cases are medical and nuanced, but I will explain it in a very simple way. There are cases, there are cancers in which there is a cancer that you see and there is a cancer that you don't, which is the limbs of the cancer. Cancer is like a crab, right? This limbs, it's going millimeters to centimeters beyond what you see. So if you have to treat that cancer in which there are limbs going far and wide, you will also have to give treatment to the seemingly normal areas, the areas which are seemingly normal, areas which are, say, you see a CT, PET or an MRI, you will see, okay, this is not having the disease. But as a cancer specialist, I know that it has it. So for that sort of a tumor, I can't be pinpointed only to the target. I have to give radiation to the normal tissues. And when I give radiation to the normal tissues, if I give such high doses, I will end up damaging because there is a lot of normal tissue in that abnormal tissue. Therefore, for those cases, you always have to do it in the long course. You can't abbreviate the course, can't make it shorter. So you have to still continue to do it in the way. Radiation therapy has evolved after lot of research. It's a branch that is most research based, and suppose the research is very clear that 25 sittings of radiation helps, then 25 sittings of radiation helps. You can't bring it to smaller radiation just because there is a new machine. But yes, that new machine will help deliver each of those 25 sittings only to the intended target and will minimize the unintended side effects. So that's about the course of treatment. But yes, there are new treatments like stereotaxy to the prostate, SBRT to the prostate, that are coming up. You could, in some cases, not give the full course of radiation to the prostate and only give 5 sittings of radiation to the prostate. So yes, some evolution is happening in this part as well. But for all practical purposes, what I said before is the scientific truth and medical reality.
Okay. So can you please tell us how this machine works?
So your question is very relevant about how the Edge machine works. So Edge machine works in the way linear accelerator works, basically. This is the head of the patient. The patient will be lying like this. This is a dummy patient. And this is the place where the radiation therapy will eventually come out from. These are the arms which will guide the first placement of the thing. But right there, up there, are the added instruments and equipments. This will throw a light onto the patient. That infrared light will help set the patient according to the skin and according to the skin contour of the patient. Once this setup has happened, this will communicate that whether the patient is absolutely in the same place as the day one or not. These two robotic arms will come out and will verify it further. This is when the patient is ready for starting the radiation therapy. But during the course of radiation therapy, these two arms, this one and this one, will continue to shoot small beams onto the patient to make sure that the target three-dimensionally is acquired at all times. So even during radiation therapy, the target will be acquired three-dimensionally and will continue to guide the precision and therapy of this patient. So I guess in this much I have told you the most salient feature of EDGE system, and this is what helps me be very confident about the thinnest and the smallest of the tumors in the body, that I can make sure that I can target them and I can eliminate them confidently. Thank you.
Thank you, sir, for giving us such useful information. So, would you like to share any message for cancer patients?
Oh, yes. My most favorite message for cancer patients is that, in this world, most of the time when the cancer patient or the cancer patient's family or the common man hears about cancer, they always hear the most negative news. That is because only the most negative news comes out. The positive stories, they are living normal life between you and me, and you will never ever come to know they are cancer survivors. So never fear, never develop fear based on the stories that you hear, on the negativity that you hear. Try to understand the science of treatment and the outcomes from your doctor, and that's when you make your impression, and that's when you make your decision about treatment. Thank you.
As sir has mentioned that you should not fear from cancer. If you are diagnosed with cancer, then you should not fear from it. You should fight for it. So that's all from our end. We hope you found this video useful. Stay tuned with us for more such videos. I, Sunidhi Singh, signing off for now. Thank you.